The history of AIDS is a gripping tale of mystery, scientific discovery, and the relentless human spirit in the face of a devastating pandemic. It all began in the early 20th century when the HIV virus is believed to have crossed from chimpanzees to humans in Central Africa, likely through hunting practices. However, it wasn't until the early 1980s that the world became aware of the syndrome caused by this virus. In 1981, the Centers for Disease Control and Prevention, CDC, reported unusual cases of a rare pneumonia and a type of cancer called Kaposi's sarcoma among young gay men in Los Angeles and New York, marking the first recognized cases of what would later be known as AIDS, acquired immunodeficiency syndrome. Initially, the disease seemed to affect primarily gay men, leading to stigma and misconceptions about its transmission. By 1982, the disease was recognized in hemophiliacs, injecting drug users, and Haitian immigrants, indicating a broader mode of transmission through blood and bodily fluids. In 1983, French scientists led by Dr. Luc Montagnier at the Pasteur Institute identified the virus responsible for AIDS, which was later named human immunodeficiency virus, HIV. Almost simultaneously, Dr. Robert Gallo's team in the United States confirmed the findings and developed a blood test for HIV, revolutionizing diagnosis and prevention efforts. The mid-1980s to 1990s saw a surge in HIV/AIDS cases globally, with millions affected across continents. The virus spared no demographic, impacting men, women, and children of all races and sexual orientations. The epidemic highlighted severe public health and social challenges, exacerbated by fear, discrimination, and misinformation. Activist groups, notably ACT UP, AIDS Coalition to Unleash Power, emerged, demanding faster drug approval, better treatment, and more research funding. Their efforts led to significant changes in healthcare policies and public awareness. The introduction of antiretroviral drugs, ARVs, in the late 1980s, particularly zidovudine (AZT), marked the first step toward managing the disease, though early treatments were often toxic and only partially effective. The 1990s brought hope with the development of combination antiretroviral therapy, ART, also known as highly active antiretroviral therapy, HAART, introduced in 1996. This regimen, combining multiple drugs to suppress the virus, transformed HIV/AIDS from a fatal disease to a manageable chronic condition for many. The impact was profound, mortality rates dropped, and the quality of life for people living with HIV improved significantly. However, access to these life-saving treatments was initially limited to wealthy countries, highlighting global disparities in healthcare. International efforts, such as the establishment of the Global Fund to Fight AIDS, Tuberculosis and Malaria in 2002, and the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, in 2003, aimed to address these inequities, expanding access to treatment in low- and middle-income countries. The early 2000s saw continued advancements in HIV treatment and prevention. The development of newer, more effective, and less toxic antiretroviral drugs improved adherence and outcomes for patients. Prevention strategies also evolved, with significant progress in understanding and implementing harm reduction techniques, such as needle exchange programs and safe sex education. The introduction of pre-exposure prophylaxis, PrEP, in 2012, a daily pill that effectively prevents HIV infection in high-risk individuals, was a game-changer in the fight against the virus. Efforts to reduce mother-to-child transmission during childbirth and breastfeeding also showed remarkable success, with rates dropping dramatically due to effective treatment protocols. Research into a potential cure and vaccine for HIV has been ongoing, albeit with significant scientific challenges. While no cure exists yet, functional cures, where the virus is undetectable without continuous treatment, have been achieved in a few cases through bone marrow transplants. These cases provide hope and direction for future research. Vaccine development has been slower, with several candidates undergoing trials but none yet proving fully effective. Despite these challenges, the scientific community remains optimistic, with ongoing research exploring novel approaches like gene editing and immune modulation. The societal impact of HIV/AIDS has been profound, reshaping public health policies, medical research priorities, and societal attitudes towards sexuality and drug use. The epidemic exposed and often exacerbated social inequalities, but it also led to greater advocacy for the rights of marginalized groups, including the LGBTQ+ community and people who use drugs. The stigma associated with HIV/AIDS has decreased over time, thanks to education, activism, and the visibility of people living with HIV who have shared their stories. However, stigma and discrimination persist, particularly in certain regions and communities, underscoring the need for continued education and advocacy. In recent years, the focus has shifted towards achieving the United Nations 90-90-90 targets, ensuring that 90% of people living with HIV know their status, 90% of those diagnosed receive sustained ART, and 90% of those on ART achieve viral suppression. Progress towards these goals has been significant, with many countries making strides in testing, treatment, and viral suppression. The COVID-19 pandemic posed new challenges, disrupting HIV services and highlighting the vulnerability of people living with HIV. However, it also underscored the importance of resilient health systems and the potential for rapid scientific advancements in addressing global health crises. Today, the fight against HIV/AIDS continues with a focus on ending the epidemic by 2030. This ambitious goal requires sustained political commitment, funding, and innovation. It involves addressing the social determinants of health, such as poverty, education, and access to healthcare, which contribute to the spread of HIV. It also means continuing to combat stigma and discrimination, ensuring that everyone, regardless of their background or circumstances, has access to prevention, treatment, and support services. In conclusion, the history of AIDS is a testament to human resilience, scientific ingenuity, and the power of advocacy. From its mysterious and terrifying emergence to the remarkable advancements in treatment and prevention, the fight against HIV/AIDS has seen incredible progress. Yet, the journey is far from over. Ongoing research, global cooperation, and unwavering commitment are essential to achieving a world where HIV is no longer a public health threat. The story of AIDS is one of triumphs and trials, of communities coming together, and of the relentless pursuit of a cure. It reminds us of the importance of compassion, the impact of collective action, and the need to continue striving for a healthier, more equitable world.